everyone, welcome to Mythbuster Monday. My name's Mo. This is Dr. Murphy. We're going to get going because we're busy people and we have things to do, right?
Yes.
Okay, so basically how this works. Mythbuster Monday, I ask him a question. He decides if it's truth or myth, and then we move on about our lives and have a great week. You ready?
Yeah, I'm sitting back. Go ahead.
Okay, so...
Can that microphone hear me from back here?
It's probably going to be harder to hear you.
My back's hurting me.
Okay. You hold this.
Oh, I got to hold the microphone
Just don't
now?
go moving it around, and then I'll scoot back, okay? All right, so we want to know, is it true that the steroid dexamethasone reduces COVID deaths among seriously ill patients?
You know, I've often wondered about this, from the beginning, because if you guys rewind my videos and watch them in the past, I said this was inflammatory. It's not the virus that's killing us, it's the inflammation from the virus. And I like that one study that said that people with rheumatoid arthritis and stuff that are taking hydroxychloroquine and stuff, it's a very potent anti-inflammatory agent is what it is. And they had a good survival. Now, the FDA has come out and says, oh, we're not using it anymore. I think you're jumping the gun here. You don't have the information. You don't have the knowledge. You guys are worthless, I think.
Yeah.
So, but dexamethasone to reduce deaths from COVID, I like this idea. And this goes right along with what I've been saying all along. Dexamethasone, prednisone, steroids in general, anti-inflammatories, big-time anti-inflammatories. And what we're doing is just reducing the inflammation in the lungs.
Yeah.
When you see those x-rays and MRIs and CT scans of these people, and we've all kind of seen them, the pictures where that's all this junk in their lungs, that is not virus. That is inflammation. That is the literally poison ivy of the lungs. It's leaking. So they're having leaky lungs. And so I think there's a lot of... I was wondering when somebody was going to have a brilliant idea of use a simple steroid. And believe it or not, dexamethasone is not the most potent one.
Which is the most potent?
Oh my God. I mean, you can get a more, what they call a... mineralocorticoid. Dexamethasone is more of a glucocorticoid. It actually helps diabetes. We use it in diabetics when they're having a low blood sugar reaction. But prednisone and hydrocortisone, I mean, they're more potent than dexamethasone. So I'd really like to see some more studies with that. And it's interesting because they use dexamethasone for high altitude pulmonary illness.
Oh, okay.
So you're at high altitudes and you start having problems with breathing and stuff. They use dexamethasone for that. And so it does have anti-inflammatory properties, but also has glucose-releasing properties. But it's really interesting. And this is right along the lines of that. And I think a lot of physicians were initially scared to use steroids because steroids and viruses and funguses normally
they
don't like to work together, okay? Because when you have viruses and funguses, you need an inflammatory response to kill it. But this one here is the virus is not the cause of the problem. It's the inflammation from it that is the problem.
Interesting.
It is incredibly interesting. And so I like the study. I like the article. And I think we got a new weapon in our fight against COVID.
And we're not saying it's a cure. We're saying it's a treatment.
And that it's
showing to seriously improve the likelihood of the ill, those who are incredibly ill, to survive.
And, once again, Michelle, this whole thing, we're going to learn some new interesting stuff about this virus and how to treat future viral infections. So there's a silver lining to this dark cloud, and it's going to be our knowledge we're going to gain from it.
Yeah.
We're going to learn more how to treat viral illnesses in the future from inflammation. We're going to find new ways to study them, to do lab tests, to check for them, and it's great. So I'm glad we're learning something.
If you can treat the issues that are resulting in the virus ravaging your body, then you might be able to save yourself instead of just going and attacking the virus.
Yeah, I want to say one other thing too. They talked about blood types. People with type A is, you got a more of a likely chance of dying. If you're type O, you're better off. That study was nonsense. I mean, it's insignificant. So don't worry about your blood type.
Okay, everyone.
Don't run to your doctor and say, I want to know my blood type.
I need to know if
I'm going to die from COVID.
Yeah.
Don't do that.
Don't do it. You'll be all right. Yeah. Or, it just doesn't have anything to do with
insignificant. Insignificant.
Okay. All right, everyone. Well, I think that's it for your Mythbuster Monday. Well, thank you for watching. If you like it.
So, myth is true.
Okay, so it's true. It's not a myth.
It's not a myth. It's true.
Yeah. Okay, perfect. All right, so that's true, at least at this point, and we'll tell you as we find out more information, because I think we're going to be talking about this for a while.
Can I drop the mic? Like, dock out?
Sure. All right, we'll see you guys on Tuesday for a Trash Talk Tuesday.